Okay, Dr. Rivera, you're standing next to an image of the nose, so please explain what you're looking at, what we're looking at here.
So this is a side view of the nose where you can appreciate the opening of the nostril here, and you can imagine airflow entering the nostril and then going down to the back of the nose, down the throat, and into the lungs. What most people don't know is on the side of the nose are these folds of tissue here called turbinates, and these are large folds of mucosa over bone, which in many people can be too large and ultimately potentially obstruct their nasal passage.
But what do they do?
Basically, the nose is covered with mucosa that is meant to filter out particles in the air. As air comes through, the mucosa produces mucus and has very small hairs that then brush that mucus to the back of your throat in a way that it can be expectorated. This increases the surface area in the nose of that mucosa and basically provides for an additional barrier against stuff that would be flowing through the air that could potentially enter your lungs and cause a problem.
Now, what causes them to swell, Dr. Rivera?
If you have inflammation, allergies, those things we talked about before, even an infection, one of the first things that happened is that the signal to the nose goes up to produce mucus, and in order to do so, the mucus becomes inflamed and will swell up. If that's the case, these you could see enlarging and obstructing the nasal passage. That's why if someone has a viral inflammation, for example, these can swell up and they will feel very stuffy or congested. If somebody has allergies or a bacterial infection, not only these will swell up, but you will also have a significant amount of bacterial drainage that might obstruct their nose as well.